good afternoon, and thank you for joining me, Dr. Rossor. Alex, thank you so much. I think first, if you could please introduce yourself and explain your link with CMT.
So my name's Alex Rossor, and I'm a neurologist based here at the National Hospital for Neurology and also Guy's and St Thomas's Hospital. And I run a joint clinic for patients with inherited peripheral neuropathy here, and also see patients over at Guy's.
And could you describe some of the key CMT research projects that are going on at the moment or might be being launched in the future?
So I think it's a really exciting time for CMT research, and I think some of the real big moves forward are actually the clinical trials that are occurring for some types of CMT. So, this is something that we really weren't thinking about 10 years ago. So there are treatments for which there are actually clinical trials going on at the moment for rarer types. So CMT due to mutations in SORD, which is a new type, and also a trial for hereditary sensory neuropathy. There's also an awful lot of work going into treatments for CMT1A, which is the commonest subtype. And there's some very interesting research using new genetic therapies, so therapies that use synthetic DNA to try and treat the underlying cause of this disease. And there aren't clinical trials at the moment, but they're probably just around the corner.
And what are the key aims of the research projects?
Well, I'll probably talk a bit about the sort of the treatments that are coming forward for CMT1A. So these are genetic therapies. And so what it's doing, what they involve using, if you like, synthetic or laboratory made pieces of DNA or similar material that can actually work in a nerve cell to try and correct the genetic problem that causes the CMT. So it's a new way of treating these diseases, and it's actually been shown to be effective in another genetic peripheral neuropathy called amyloid. So that really is very exciting. And then similar to that, and it hasn't quite entered large-scale trials at the moment, but is other types of CMT where there's not enough of a particular protein, actually trying to deliver bits of DNA to cells using viruses. So there's a lot of work being done in animal models of CMT at the moment, trying to take that forward. So it's a very exciting time.
And is there anything that the CMT community itself can do to help or get involved with any of these research projects?
So that's a very good question, and the answer to that is most certainly yes. So at the moment there's lots of work being done trying to take things forward to clinical trials, but then there are going to be clinical trials, and one of the difficulties is going to be identifying patients or individuals with CMT who are going to be able to take part in these trials. And that's really where CMT UK has, and your membership has a big role to play, really people putting themselves forward if they're interested in partaking in a trial in advance. And so, CMT UK has partly funded this, but we're setting up a database where individuals will be able to enroll themselves, and that'll be through a web link. And people will be able to do that themselves without actually having to have a doctor do it for them. And at the moment, that is just going through the final ethical steps. We hope to have that up and ready in the coming months. And, it'd be really helpful to have as many people as possible enrolling in that.
Well, we'll certainly be promoting that when the time comes, definitely, to encourage people to sign up for that. Thank you so much for your time. That's been really helpful. Thank you.